Hello everyone, I am Dr. Tulsidas Patil. Today I am going to discuss about IgE mediated type 1 hypersensitivity reaction under the pharmaceutical biotechnology course of third year B Pharm as per PCI syllabus. Before going for the presentation, I want to make a disclaimer that this presentation is made for educational purpose only and not meant for any commercial interest. The information provided in the presentation by me is taken from my own personal experiences and understanding and from the reference which I have quoted at the presentation, at the end of my presentation. So these are the learning outcomes. I will first discuss about the basic definition of hypersensitivity reaction. What are the different types or classification of hypersensitivity reaction? Then I will specifically focus about the type 1 hypersensitivity reaction. Under that, I will cover the mechanism of anaphylaxis, what is the localized or cutaneous anaphylaxis, that is atopy, and then I will cover different examples of type 1 hypersensitivity reaction. So let's start with the discussion. First, first is hypersensitivity reaction. So everyone know that our immunity is considered as a protective process which help our body to overcome about various infectious agents and their toxins, but sometimes our immune response may be injurious to our host cells. So when I consider hypersensitivity reaction, it can be defined in different forms. Like it is an abnormal sensitivity to the stimulus of any kind. It is like a immune response which resulted in the form of exaggerated or inappropriate reaction, which is definitely harmful to the host body. Or we can define hypersensitivity reaction as a undesirable injurious consequences in a sensitized host following the contact with the specific antigen and thereby giving rise to the damage to the tissue. So, for induction of the hypersensitivity reactions, that person must have had contact with the particular antigen, which is referred as an allergen. So when that person get initial contact, it sensitizes his or her immune system. So that leads to priming of the immune response, either by activation of appropriate B cells or T lymphocytes. So this antigen dose, which is responsible for sensitization, is referred as sensitizing or priming dose. Whereas upon subsequent contact of the same allergen or antigen, it causes the manifestations of the hypersensitivity reaction. So this dose of antigen or allergen is referred as shocking dose. So depending upon the time taken by that particular hypersensitivity reaction and the mechanism involved in it, we can classify broadly the different hypersensitivity reactions into two major classes: immediate hypersensitivity type of reaction and delayed type of hypersensitivity reaction. So as the name indicates itself, immediate type of hypersensitivity reactions are those which carried out or which are seen within few minutes or hours after exposure to the particular antigen, whereas delayed type of hypersensitivity reactions takes a days to manifestate their symptoms. So if I want to differentiate broadly in between these two classes, what is the difference in between immediate and delayed type of hypersensitivity reaction? So the types which are involved in immediate type of hypersensitivity reactions are type 1, 2, and 3, whereas type 4 comes under delayed type of hypersensitivity reaction. Time of manifestation for this immediate kind of hypersensitivity reaction, it takes minutes to hours, as I have already told you, and the delayed type of hypersensitivity reactions take a days to manifest it. Mediators, if we talk, immunoglobulins or antibodies are the main mediators in immediate type of hypersensitivity reactions, whereas T cells are involved in delayed type of hypersensitivity reactions. If we consider the route of sensitization, the immediate kind of hypersensitivity reactions are sensitized by any route, whereas delayed type of hypersensitivity reaction mostly caused due to intradermal route. Then, if I want to discuss about passive transfer within the serum, whether that immediate type of hypersensitivity reaction is able to transfer passively with the serum, yes, it is possible to transfer passively with the serum, whereas delayed type of hypersensitivity reaction, these are not possible to transfer by this route or by this way. Then desensitization is it is easy to desensitize immediate type of hypersensitivity reaction, but it is short-lived. On the other hand, delayed type of hypersensitivity reactions are difficult to desensitize, but they take long lasting or the desensitization will be long lasting. If I consider the potential of hypersensitivity reaction, this immediate type of hypersensitivity reactions are mostly fatal, whereas the delayed are mostly non-fatal. So this is the basic broad differentiation in between these two major categories, immediate and delayed type of hypersensitivity reaction. So Combs and Gale are the ones who in 1963 classified these hypersensitivity reactions in four different types. Type 1 is considered as immediate or anaphylactic type of hypersensitivity reaction. Type 2 is referred as cytotoxic type of hypersensitivity reaction. Type 3 is referred as immune complex related hypersensitivity reaction. And type 4 is referred as delayed or cell mediated hypersensitivity reaction. So as we have seen in a table, type 1, 2, 3 are the antibody mediated and referred as immediate type of hypersensitivity reaction, whereas type 4 is referred as cell mediated and it is a delayed type of hypersensitivity reaction. Now we will focus on to type 1 hypersensitivity reaction. So type 1 is immediate or it is also referred as anaphylactic or it is also referred as IgE mediated hypersensitivity reaction. So this is an immediate type where there is an involvement of particular antigens which we refer them as allergens. So it occurs when the allergens binds to the cell fixed antibodies, most specifically IgE antibodies, which are present onto the surface of sensitized mast cells and basophils. So these will lead to release of vasoactive amines that are histamines, serotonin, or others, which will lead to the further chemical reaction. So this is the overview, or we can say the general principle which is involved in the immediate type of hypersensitivity reaction. Now we will see the mechanism, how actually it happens. So when the B cells comes in exposure to the antigen with the help of helper T cells that are CD4 plus cells, that B cells will get differentiated into two types of cells that are referred as memory B cells and plasma B cells. After this antigen or allergen exposure, the plasma B cells will secrete immunoglobulin E, that is allergen specific IgE antibodies. So this class of antibody is having high affinity for the Fc receptors which are exposed onto the surface of mast cells or basophil cells. So these mast cells and basophil cells, which are having Fc receptors, so these IgE antibodies will go and bind to these Fc receptors, which are present onto the mast cell. After this formation of the complex of IgE with the Fc receptor, those mast cells are said to be sensitized, and we refer them as a sensitized mast cells. Now, this is the first exposure of antigen. Later on, when that antigen will expose to that particular individual or that allergen which exposed to that individual, then that allergen will leads to cross-linking of the IgE antibodies, cross-linking of the IgE antibodies, and this leads to rapid degranulation of these mast cells, and there is a release of granules from these mast cells. Now, these granules will be responsible for secretion of the inflammatory mediators, like they secrete histamines, heparins, serotonins, leukotrienes, prostaglandins, and this release will lead to further manifestations of the type 1 hypersensitivity reaction. So, this is a mechanism which is involved in the anaphylaxis. When I say localized or cutaneous anaphylaxis, it is also referred as atopy. Now, what it is, we will see. So, when there is a administration of small shocking dose of the allergen or antigen intradermally, it will lead to creation of will and flare response, which is referred as local anaphylaxis. So, what is will and flare response basically? Will is nothing but the pale central area of puffiness due to edema. Means there is an increase in the permeability of the blood capillaries, and this wheel is surrounded by the flare. Flare is nothing but the hyperemia, means there will be the excess blood flow within those vessels. And so we notice this will and flare response. Okay, the pale central area of puffiness surrounded by the flare, which is caused due to the excess blood flow. So these reactions are maximum in 10 to 30 minutes after exposure of that antigen or allergen, and they will fade away easily after few hours. So cutaneous anaphylaxis we can also use as a skin test for testing various kind of allergens which are responsible for atopic disorders. So this is all about the anaphylaxis, that is localized anaphylaxis or atopy. Now we will see different examples. You might have come across these examples. When I consider the manifestations of type 1 hypersensitivity reaction, they cause because of the vasodilation and smooth muscle contraction after exposure of the allergen. So it can be further categorized as systemic anaphylaxis or localized anaphylaxis. Systemic anaphylaxis is like we can say food allergies, then drug allergies due to penicillin, then insect bite like bee sting, which will lead to secretion of the venom, and it leads to type 1 hypersensitivity reaction like this. Okay, then there can be a possibility of hypersensitivity reaction because of the physical stimuli, like excessive exercise. So these are all about, or these are the different examples of systemic anaphylaxis. When I say localized anaphylaxis, it is like hay fever, then asthma, then hives, we can consider hives, or different food allergies or eczema. So these are the different examples of the type 1 hypersensitivity reaction, which are either expressed as the systemic anaphylaxis or localized anaphylaxis. So I have taken this information from the Cubase immunology book, which is mentioned in chapter 16, that is hypersensitivity reaction. So thank you so much for your patience listening.